Today I will be talking about the Delta variant, but also first I want to talk about what's happening here in the county and move from there. So, well, this is a picture of our website, and this is where we place information for the public, and there is a lot of information about the vaccination campaign, also the testing resources, and a lot of educational material for the community, and every day you can go there and find information about the trend of the disease in Clark County and everything that you might want to know regarding this community and COVID. This is a picture of the pandemic in Clark County from the very beginning, and the different surge that we have suffered so far, including the current one that started somewhere by the end of May, and has been going up until about 3 weeks ago, when we start to observe a decrease in the number of cases. Right now, that decrease is consistent with what we have seen with the positivity rate in Clark County. That positivity rate 3 weeks ago was at 18%, which was very close to the peak that we saw back in December of 20% positivity rate. Right now, it is around 10%, and again, is decreasing, which means that the transmission of the virus in this community is decreasing, but still we are far away from the target. The target is to be under 5%, which is the value established by the CDC and also World Health Organization. I have to mention that last May we were at about 3.5%. So we were there, and we just came back to those crazy numbers. We have also placed a lot of testing facilities across the county. We contracted with 2 or 3 companies, and we are offering mobile testing at different sites in the community, in addition to testing at a community college and also at the school facilities. And of course, our public health lab is also doing testing, supporting mostly nursing homes and other facilities like correctional settings. This is the status of our vaccination campaign. We have administered more than 2 million doses of vaccine here in Clark County. As you can see, our values here, we have about 58% of people in Clark County who initiated the vaccination, and even so, I would say this is a really good number. We are a little bit below the country. The United States right now is at 62% vaccine initiated, and 47% of our population has already completed the 2 doses of Pfizer, Moderna, or the 1 dose of Johnson & Johnson. This is just, you can see the distribution of vaccination initiated by age group, and you can see there is a gradient that goes according to age, and the senior population has really been very active when it is looking for the vaccination, and they have reached really high levels of vaccination here in Clark County, as opposed to the younger groups, especially the 20 to 29 years old or or underneath that age group, which are really relatively low. And this is the age group with a completed vaccination, whether it is 2 doses of Moderna, Pfizer, or 1 dose of Johnson & Johnson. And again, you see the same gradient going with the seniors actually having the higher levels of vaccination, which is great in terms of preventing severity, whether it is hospital admissions or death here in the county. So the demand that we have seen from the senior population has really helped decrease mortality and hospitalization here in Clark County. This is, I just wanted to, because there have been a lot of questions in the community, because I probably could say kind of confusing information that came from the CDC a few days ago. And, like one day they said that there would be a third dose recommended for people who suffer immune depressive conditions, and like 2 days.
Or do you want me to make you like a cheesy egg with salami?
Sorry. Okay, somebody's cooking there. So and then 2 days later, the CDC came out with a recommendation of the booster vaccine for or the federal government for those who have completed the 2 doses of Pfizer at least 8 months ago. Those 2 announcements really created some confusion, because especially if for those who are not in the healthcare environment, they couldn't understand what it was about. And the issue really was for the CDC recommending the third dose, which is not equivalent as a booster for those who are suffering from immune compromising conditions, because of the studies pointing out that people with those conditions have not been developing enough antibodies after the first and second shot of Pfizer in this case, because the studies were based on Pfizer. So, and this is what the recommendation for the booster. I created this slide like over a week ago, but in the last 2 or 3 days, probably some of you have already been aware there are some issues now between the CDC and the White House, FDA, regarding the booster vaccination, and when this should be offered and what the procedure for that. The bottom line is that the offering the booster vaccination for everybody who has 8 months or more from the second dose actually might interfere with the main goal of the campaign today, which is reaching out to those who are unvaccinated. So that's really the bottom line of that discussion. But this is what the federal government is looking at. But today, you asked me, I'm not sure if they will actually offer the boosters for everybody initially, just because of the issue of how quickly to get most people who are unvaccinated, receiving the vaccine. But this is anyway the priority group for the booster still will remain the same, because of course residents of long-term care facilities and healthcare providers, especially those who are in the hospital setting, are the first priority for this vaccination campaign and for any activities related to that in the future. And this is more for the general public. Johnson & Johnson is not recommended as a booster today. And the reason is because there is not any study yet supporting that. And also because Johnson & Johnson, remember, we started offering that in March. So it's running like a two or 3 months late than the other vaccines. And here, I just wanted to quickly share with you the chart to the right, which is the reproductive value of COVID in our community. And as you can see there, and this chart started in May, there is when we start to see an increase in the number of cases, and of course it is related with the reproduction rate going up beyond 1.0. The contributing factor to that is that actually at that time was when the Delta variant started to appear in our community. At that time, still the percentage of Delta virus in Clark County was relatively low, but it has been increasing since then. And this is information that Dr. Medina was mentioning before, and there are multiple studies supporting the information that this Delta variant is quite more contagious than Alpha variant, or the original coronavirus COVID-19 variants. There are studies done here, report from the CDC, where they say that it is 2 and almost 3 times as contagious as the Alpha variant. And of course, fully vaccinated people are able to transmit the virus, but it is not limited to Delta. They could transmit any variant of coronavirus. And this is an educational material from the CDC, directed mostly to the general population, just to show in a very simple and graphic way how contagious Delta variant is. This is like, I know Dr. Medina already referred to this one, and again, the orange color is Delta variant, and as you can see, since mid-May, when it was about 3 to 5% of all variants circulating in the United States, until today, when it is almost 97, 98% of the virus circulating, and this is the same across any region, state of the country. This is data from here in Clark County, and as you can see, what we have here is to the right. This is the last 30 days. We identified almost 900 specimen with Delta. I have to make the disclaimer first that not all the specimens are actually sent to the lab for sequencing. So it's a limited number of specimen, but from the specimen that we run our lab or in Reno, almost 99% are Delta for the last 30 days. And this is Clark County information. And this is a report from a study in the United Kingdom where they look at the effectiveness of Pfizer and AstraZeneca, and compared to the Delta variant. And this is what they found was that actually Pfizer, 2 doses of Pfizer are 88% effective preventing symptomatic presentation of Delta variant in the community. So when they say on this same study, when they look at the first dose, actually Pfizer and AstraZeneca were somewhere in about 35% effective. So what it means is that 1 dose of Pfizer or of AstraZeneca are, I would say, very low in terms of protection. But when you apply the second dose, then you really have a really effective result. And this, I wanted to show you some data from Clark County again. And this is the, I don't want to call these breakthrough cases. I would say cases among vaccinated people. And the reason I want to say it that way is because the CDC has a definition for breakthrough cases. In order to be classified as a breakthrough case, the individual must have the 2 doses of Pfizer or Moderna, or the 1 dose of Johnson & Johnson. And the individual must be either hospitalized or dead. And it must be at least 14 days from the last dose. So that's the definition of breakthrough cases from the CDC. And when you apply that definition, then what you have is a really small number of cases. So for just to give you an example, and this number is from last week, it's not from today, but last week we had 359 breakthrough cases according to this definition of the CDC, and 112 deaths. Well, when we run that as confirmed cases among fully vaccinated people, then the number, instead of 359, go to about 7,000 people. So and we prefer to share this information that way because we believe it gives you a real idea of what's happening in the community. About 7,000 vaccinated cases looks like a huge number, but really, when you look at a community that has already over 1 million of people fully vaccinated, it comes to about 1 case per, about 66 cases per 10,000 fully vaccinated people. And when it comes to the deaths, it's about 1 death over 10,000 fully vaccinated people, which means that the vaccine has been really, really protective. And this is a comparison of the cases among fully vaccinated and unvaccinated in Clark County. And as you can see here, the rate of the number of cases, or the rate for not vaccinated people in Clark County is about 5 times what you see among vaccinated people. And I have to say that among we're calling not fully vaccinated because because there are also people who has a 1 dose of Pfizer or Moderna, so they are not fully vaccinated, and we are just counting in that group of unvaccinated people. And this is the distribution of fully vaccinated cases by age. And most of the cases are in the younger population, 25 to 29 to 49 years old, as you could see there. And the seniors represent about 23% of those cases. But when we go and look at hospitalizations, then the picture start to change, because now what we have is that most of the hospitalizations are for patients who are between 50 years and over. So we have more than 90% of the hospitalizations among people who are 50 years old and over. And of course, if you just go to 65 and over, that's the group that's really hurt, of course, which is consistent with the history of this virus from the very beginning of this pandemic. And then when we look at the deaths among fully vaccinated people, is very similar to what we saw with the hospitalizations. Again, most of the deaths are for people 50 years old and over. And they represent more than 97% of the deaths reported in the county. And I will stop here. Thank you.
Thank you, Dr. Leguen. We have a couple of questions for you in the chat. The first one is regarding the use of antibiotics for community-acquired pneumonia in patients admitted with COVID-19 pneumonia. It's difficult to tell our colleagues not to use antibiotics. What the person is asking or stating the question is, they usually leave them on for a day or two and then reassess. The use of doxy by other ID providers is difficult to explain without knowing the clinical context of their decision. And it's, yes.
That's my answer to.
Oh, that's your answer. Oh, I'm so sorry. Thank you for interrupting me. So would you like to make any other comments on this? I'm so sorry.
Oh no, just really the statement as it is, right? So most patients with COVID-19 pneumonia, that when they present to the hospital, they really don't have a bacterial super infection, and that's been shown in multiple studies done across the world. Clinically, it's very difficult to tell a provider, look, this patient comes in a sepsis syndrome, but don't give them antibiotics. Just our thought process is so wired to that sepsis protocol that you're just, automatically giving everybody antibiotics. So my take on that is the clinical syndrome and the clinical judgment of the physician prevails, but think of it as something that you're doing now, but look at de-escalation, right? So if you have 24 to 48 hours, the patient starts getting better or it doesn't get worse, or really everything is explainable due to COVID, then stop the antibiotics.
Okay, thank you. There is a question for Dr. Leguen. What is the recommendation for someone who had COVID? Do they need any vaccine? Do they need a 1-dose booster? Do they really need a 2-dose vaccine if they had COVID?
Sure, thank you. Okay, yeah, I think that the bottom line of that question is natural immunity versus the vaccine. So the current recommendation from the CDC is that a person who suffered COVID, once they are without signs or symptoms, they should be vaccinated. So the recommendation is for them to receive the full schedule of vaccine, whether it is 1 dose of Johnson & Johnson or the 2 doses of Moderna and Pfizer. So that's the current recommendation. There are discussions, of course, of whether natural immunity lasts longer than what is being said. So far, there is not yet a strong evidence supporting that. But again, as we know, there is more that we don't know about COVID than what is actually present in the literature today. So, but the recommendation is to receive the two doses of the vaccine.
And if I could just add a quick comment to that, one also has to remember that the immune response depends on the severity of illness, right? So if you had a mild case of COVID, it is likely that you have a lower amount of antibody production. And on top of that, you really don't know what level constitutes protective immunity. So that's very challenging. That's why, Dr. Leguen and everybody else is recommending what CDC is recommending, which is full vaccination for everyone.
Okay, and then there's kind of a second item, so Dr. Leguen, I heard data from one of our hospitals that a large percentage of adults in Nevada who received the first dose are not planning on getting a second dose, and now they're beyond the window. Can you confirm this? If so, it means these people are not protected by the vaccine. And if you'd have any comments on that.
Yeah, sure. Thank you. Well, I mean, what we know is that, and of course, we are referring to Moderna or Pfizer in this case, is that one dose of the vaccine is not fully protective. Actually, the proportion of people who develops protection against severity of death from the first dose is very low compared to when they receive the two doses of the vaccine. And also receiving just one dose of the vaccine will provide a shorter term of protection for the person.
Okay, thank you. One last question, and then we'll move on. Dr. Leguen, the outpatient setting, in the outpatient setting for high-risk, fully vaccinated patients, for instance, a renal transplant patient, should we be monitoring antibodies or antibody levels?
I would say that's more of a logistical question, I would say, because it depends, I don't know, the resources. There are a lot of complexity probably added to that question. I would say high-risk patients, immune compromised patients, that those kind of conditions, perhaps the best thing that we can do in our practice first is to make sure that the environment is proper and we provide enough infection control measures there to protect them from any infection that they could acquire at the practice, and also their exposure to other people when they come to the office. Regarding testing for identifying the level of protection, I would say that's something that it will be up to the practice, and again, it's more of a logistical and resources question, and not to mention insurance and and all the complexities of healthcare that we know.
Okay, thank you.